A caregiver asked me yesterday if someone gets a virus or the coronavirus, should they go to the hospital? The answer is no, unless. I'm Pamela D. Wilson. Stay with me for the caregiving chat of the day. In this video post, there is a link to an article on my blog about viruses. You can also check out my radio show, The Caring Generation. It airs every Wednesday night on my website at PamelaDWilson.com. How many of you remember these things? Do you know what they're called? They're called hankies. Back in the good old days, as my dad would say, we actually used hankies to blow our nose instead of Kleenex. We used hankies to sneeze into, to cough into. We use them for all kinds of things. One of my best friends collects handkerchiefs. She's got an amazing collection. And I'm pretty sure this is one that she may have given me. So let's talk about hospitals and why we go to the hospital and why we wouldn't go to the hospital. Hospitals treat acute situations. If you are a caregiver and you have an elderly parent who has been in the hospital for any serious reason, you know that it's difficult to get admitted to the hospital unless you have a very serious life-threatening condition, like you're having a heart attack, like you had a stroke. A virus, a normal virus, like the coronavirus, they can't do anything for you. There's no cure. Antibiotics don't treat it because it's a viral infection. The best thing that you can do is to stay home, stay away from people, don't cough or sneeze on anybody else, and get over it. 80% of people don't even know they have the virus. They will have a little bit of a cold and go on with everyday life as it was everyday life. The other 20%, 10 on the young side and 10 on the old side, are the people that will have trouble. As my dad used to say, it's the old timers, the older people who have a lot of health issues, who may have heart disease and breathing issues like COPD or asthma or bronchitis, other health issues, diabetes. People who have a lot of health issues are in poorer health than those of us who can easily recover from a common cold. Those are the people that hospitals may admit, but not always, again, unless they are having acute respiratory distress, unless they need to be on a respirator, unless they really need a lot of care. Otherwise, they can stay home and take care of themselves or have someone take care of them. And if they live in a care community, they can stay there and receive care there. If you've listened to all the news, it's a lot of fluids, it's taking care of yourself. One other thing that we don't take into account, especially for the elderly, is nutrition. I did a radio show on this a couple of weeks ago and interviewed Dr. Nicholas Dutz about nutrition. Many older adults, about 40%, because you can't tell by looking, are malnutritioned because they don't get enough protein in their diet. If your mom or dad is physically weak or they don't feel good, part of that, in addition to any kind of illness, could be nutrition. They're not getting enough protein intake into their body, so they're tired, they're physically weak, they may have balance problems, they may be falling. The simple antidote to that is in that radio show from a couple of weeks ago, and it's getting more protein into the body. You can find that radio show on my website at PamelaDWilson.com. Click on the media tab. Once you get to the media tab, scroll down, The Caring Generation will be there. And look for the radio show called Warning Signs About Caring for Elderly Parents. That interview is in there with a lot of helpful information. I'm Pamela D. Wilson. My website is PamelaDWilson.com. Have a fabulous day today. Take care of yourselves. Stay home if you're sick. Use a hanky. I'll see you again in another video.